Are you Kevin?
I am.
Hi, I'm Tabitha. I'm gonna be with you on Shanana O'Connor in 231. Could you give me SBAR, please?
I sure can. This young lady's name is Shanana O'Connor. She's around 231. She was admitted with a fever of unknown origin. She's a 34-year-old female, 5'9", weighs 177 pounds. She's a full code. She's got an allergy to sulfa drugs, which creates a moderate rash. Low fall risk. She was diagnosed with type 1 diabetes at age 8 and has currently had end-stage renal disease for about a year. She is on the transplant list for new kidneys and has been on it for about 6 months right now. She's still waiting. She has a history of proliferative retinopathy and diabetic neuropathy. She had a graft infection 3 months ago that resolved with IV antibiotics. She's also got a history of recurrent UTI. She arrived at the ER this morning about 5:30, complaining of fevers, chills, and general malaise. She reported elevated blood sugar readings and decreased appetite for the past few days, with minimal urine output for the last month. Her vital signs at 7:30 were 101.1 temp, 95 heart rate, 96 pulse ox, 20 respirations, and 138 over 78. Her AccuCheck also at 7:30 was 155. All right. So upon examination, Ms. Connors appears uncomfortable, but not in acute distress. Her skin was warm and intact with mild diaphoresis. She has a functioning AV graft, which appears clean, pink, and intact with bruit and thrill present. Her nail beds are pink with cap refill less than 4 seconds. She is tachycardic a little bit and has been on and off. She's got no murmurs or extra heart sounds. She's got some pitting edema in her lower extremities. Pedal pulses are both present in her feet. Her cap refill in her toes is also less than 4 seconds. Chest expansion is symmetrical, and all lobes are clear to auscultation. She's got normal range of movement in her joints, and strength is normal for her. She is on a renal diet with fluid restriction of 1,500 mLs a day. Her abdomen was soft, round, and non-tender. She's got no visible masses, bladder distension. All bowel sounds were present in the 4 quadrants. Her intake thus far is 375 milliliters, and her output is 200 milliliters. Is there anything else you want to know?
Yeah, I had a couple questions.
Okay.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
We are giving her this medication, imipenem, because it is a broad-spectrum antibiotic. We're still waiting for some of the labs to come back to tell us a specific infection. So right now we're just treating it with a broad antibiotic.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored? Which physiological parameters should be monitored when the medication is being administered?
Okay, because she is an end-stage renal disease, that's gonna have an effect on the half-life and the serum levels. So we have to take that into account. We also need to obtain specimen cultures and sensitivity prior to administering it. We need to monitor the vital signs and assess for worsening infection through temp and a white blood cell count.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting, and what interventions must be taught for taking the medication safely at home?
In the hospital setting, we just want to have the patient let us know if there's any side effects happening. And this med isn't given for home use, so we don't have to worry about that.
Okay. What are the side effects and potential adverse reactions?
Usually it's nausea, vomiting, infectious diarrhea, and gastroenteritis.
And how will you know this medication is effective?
We will see a decline in her fever and in the total white blood cell counts.
Okay. That's all my questions for right now.
All right. Well, we're going to go in and we're going to hang some fluids.
Okay.
And give her some IV antibiotics. Okay. So
Okay.
I'm going to show you here how we're going to spike the fluid bag.
Okay.
And prime the line. All right. Take that out. Pop the top off here. It's very sharp and it's sterile, so we don't want to touch that.
Okay.
We're going to pop this blue cord out. This is also sterile, so we don't want to touch that. All right. I'm going to prime this here. All right. And before we turn it over, we're going to make sure the line is closed because it doesn't come closed.
Okay.
We're going to close that so it doesn't leak everywhere. Okay. We're going to make sure it's filled about halfway, and then to prime the line, we're going to make sure that it's a sink or garbage can. We're going to undo the line here so it's open, and we're going to give a little squeeze to make sure that all the air bubbles come out, and then we're watching the fluid come out just like that.
Okay.
All right. Close off this line again. We're going to flick all the insertion hubs, just going to make sure that the air is out of them. All right. All right, we'll go on in there and hang this along with the antibiotic, okay?
Okay.
All right.
Yeah.
Hi there, Miss O'Connor. My name is Kevin. I'm going to be your nurse today. I have a nursing one student here, Tabitha, with me. Do you mind if she comes in?
Hi, Miss O'Connor.
All right. I'm going to hang some fluids on you here and give you some IV antibiotics, okay? All right. Put some gloves on. Well, actually, I'm going to wash my hands.
Oh, that's how long is it? Seriously? Oh, but it was the computer most. Yeah, that's all it was.
How are you doing today, Miss O'Connor?
I'm great. How are you?
I'm all right. Thank you for asking. All right, we're going to get you feeling better here with these antibiotics, okay?
Okay.
All right, just want to check some info on you here. What's your first and last name?
Shanna O'Connor,
And when's your date of birth?
October 21st, 1979.
All right. Any allergies?
Salsa.
Okay. All right. So we're gonna
Okay.
come over here. We're gonna hang the fluid here. We're gonna take the line. Turn on the pump.
Whatever, like, I administered the medication, I documented it first, but if I didn't document it, I wouldn't have
Make sure all this is starting to get set up, and while that starts, we're gonna go to the MAR so we can document everything.
That thing is really loud.
It is. You're right.
And then my freaking primary was like not freaking priming for some reason.
All right. So go to the MAR. All right. So right here, there's the green light.
Okay.
Right there. It says so we got to. That's something we can give. So we're gonna go there. We're gonna get this thing ready to. All right, we're gonna get this thing set up here. This thing taken care of. All right, we're gonna scan patient ID. What's your first and last name again?
Shanna O'Connor,
When's your birthday?
October 21st, 1979.
All right. Any allergies?
Salsa.
All right. Got that. I'm gonna scan the medication barcode. All right. It's all set up. It's gonna be going at 30 mLs an hour. We're gonna put it into the right hand there. All right. Time's gonna be 11:45.
It's 7:30.
Oh, it's 7:30. Okay.
Yeah. A couple hours ahead. You trying to get to lunch?
Yeah. Sorry. Thank you for correcting me. All right. So let's get this thing going here. All right. So yes, there's a new patient. Yep. To that.
And that he ended up traveling to
Go down
maybe he married like this chick. And that she they were gonna
there. All right.
Thailand, so we still travel. We never got to see her. That like they're really into voodoo. And like
We're gonna select the channel. I'm going to choose guardrail IV fluids. It's normal saline. That is correct. I'm going to put it at a rate of 30 an hour. And the total amount, because you don't ever want to bleed the bag dry, we're going to say maybe about 10 mLs less than the total thing. So we'll say 490. All right. And then we're going to hook it up to her before we hit start so it's not running everywhere. All right. We're going to scrub the hub here very clean for about 15 seconds.
Yeah, that could be a post video.
In there.
Oh yeah, well, I'm gonna do the dictation. I'm gonna do the.
All right. Gonna check the patency of the line before we start here.
But you know what?
All right, you see it flowing through. It's going in there. Everything appears to be good, intact.
Yeah, you can just.
Make sure that it's unclamped.
And then if you remember something, you can like that.
And then we're gonna hit start. Unless we want it to run at normal gravity, we're going to put it into here.
Okay. That makes sense.
I know. I was like, oh, sorry.
For some reason it's not closing for me. There we go. Unclamped, ready. Let's try this again. All right.
Okay.
We're going to stand here. Make sure 5 drops come out. Make sure it's flowing correctly. Okay, so 5 drops have come out. It's going to be much slower because it's only going at 30
Okay.
ml an hour, so
That makes
that would
sense.
take us for a very long time to actually watch that, but that is the rule. All right. Well, there's air in the line here. We're going to flick the sights here, see if we can get that air out. Sometimes you just got to hit restart and it'll
Okay.
get situated. We're going to chart how the patient took it here. All right. All right, so that one's done.
Okay.
Now we're going to handle the antibiotic. All right. Right now, for some reason, this keeps beeping, so we're going to see if we can adjust it. Sometimes you just got to pop these things open
Okay.
and make sure that they can be temperamental. Let's try this again there. All right, so similar story as the main fluid line for the secondary. Okay, we're gonna take this out. Gonna make sure that it's closed. All right. I'm gonna run this thing down a little bit so it's not right there at the. All right. Pop this out. Pop this in. Both are sterile, so you don't want to touch either end. All right. And leave that here. Keep that just like that. All right. We're gonna open this chart up here. We're gonna scan. All right. So one more time. What's your first and last name, ma'am?
Shanana O'Connor.
Okay. And when's your date of birth?
October 21st, 1979.
All right. Any allergies?
Sulfa drug.
Alright, so scan that. We're gonna scan the barcode. Okay. This is saying 500 milligrams IV piggyback every 8 hours. All right, so this is starting at 8. So current time is actually 8, but put that in there. Okay, and we're gonna do our little thing here. I like to just scrub the hub here.
Okay.
So another 15 seconds to make sure it's as clean as possible. Alright, we're gonna hook our line up here. And then we're gonna backflow this here to make sure that it's set to run, okay?
Okay.
So we're gonna just kinda keep it low here, and we're gonna let the normal saline fill this up here until it's about halfway full. So now we're gonna, got a little bit more than that, so we're gonna push it in. Alright, there we go. Close enough. Alright?
Okay.
Okay, so now we're gonna put the antibiotic hung the highest, alright? And we're gonna hang the regular saline lower. It's all set there, okay? So now we just gotta add it in, okay? So we're gonna go to channel select, secondary. We're gonna find the right medication here. There it is right there, imipenem. I'm gonna choose that. It's saying 500 milligrams. Yep, that's the one, right? Oh no, that's actually not, yeah, that is the one. It's in 100, so that's correct. We're just gonna choose the predetermined one. This is correct, the dose. We verified already. All right, it's got it all laid out for us.
Okay.
All right, so all we're gonna do is hit next. Oh, we hit the wrong button here. We're gonna go. We're gonna go back and we're just gonna restart that. There we go. Okay. Next. All right. It's going to be over 8 hours. So we're going to go. Alright, we're going to change this time here. It's going to be over an hour. We're going to hit start. Make sure that the line is open
Okay.
for the secondary. And again, we're going to make sure that 5 drops come out of here. They have, and we're all set. So,
Okay. Cool.
all right, Miss O'Connor, is there anything else we can get you?
Nope.
Any questions you have about anything? All right, well,
Thank
here is some patient education about that drug and the side effects, okay?
Okay.
If you need anything, just make sure that you hit the call bell, and we'll come in to help you out, okay?
Thank you.
All right, no problem.
Okay, I'm gonna have a couple more questions for
Okay.
you. Were there any pertinent pieces of information you reviewed before administering the client the medication?
We did check the white blood cell count and the temperature, and they were elevated, which means that until we get the cultures back to no, we're just going to treat with this broad spectrum antibiotic.
Okay. So did this information affect your decision to administer the medication?
It did. Due to the elevation in the labs and the temp, it was required to fight the infection to give an antibiotic.
And did this information affect how you administered the medication?
No.
No?
Nope. It was going to be IV one way or the other.
Okay, thank you so much for your time.
No problem. Thank you.